So let's talk about recognition. What happens in laryngospasm? You see here on our 3D model, this is the airway. You can see, you can walk around and you can actually see in different planes how the airway sort of progresses down through the head and neck. If you'd like to, you can actually pause the recording and you can use the cutting tool here, which appears as sort of an interrupted blue square, to pan through the airway. You can actually look at in sagittal and coronal planes. You can use there's a little sort of a orb that's floating. You can actually take that if you grab it with your controller, and you can actually move it back and forth, and so you can turn the model so you can see it more closely. And that will actually allow you to inspect the airway a little more closely if you'd like to. So I want to demonstrate here. This is the glottis. So you can actually see here are the vocal cords. And so the first thing that you'll notice when a patient begins to have laryngospasm, they will actually start to have inspiratory stridor. And then there will be an increased respiratory effort. So you'll start to see tracheal tugging, paradoxical respiratory effort. And sometimes on the monitor, this actually appears as an increased respiratory rate, although the breathing may actually be very ineffective. After that, you'll start to see decreasing pulse ox, and then that may lead to bradycardia, which I'll show you on the monitor here in a minute. You'll notice here's actually a video of laryngospasm. This is sort of a simulated laryngospasm. I'm just going to overlay this here so you can kind of see how that transpires. When you look directly at the screen, the video will start to loop, and then if you look away, it will reset. So you'll notice that the cords start to close, and when they're here in this where they're in the closed state, that is actually sustained in laryngospasm, so the vocal cords remain closed. If you were to proceed to intubating the patient, that maybe what you see is closed cords, either completely or partially closed cords. You can actually make the video bigger so that you can see more closely what that looks like when under direct laryngoscopy. So we'll talk about the vital sign changes that occur in laryngospasm. So these are just 3 video clips of laryngospasm, sort of beginning and end. So you'll notice here in this first one, this is actually normal vital signs. This is a patient that's being monitored during sedation. So you'll notice heart rate is age appropriate, pulse ox is maintained, your end-tidal CO2 is in orange, and then you'll notice down at the bottom of the screen, it's a respiratory rate. In this case, the respiratory rate is 32. And it's very important to note that because in laryngospasm, one of the first things you notice is that the respiratory rate will actually start to increase as a result of that paradoxical chest movement that I just mentioned. So in this second video clip, you'll notice that the first thing that starts to happen is that the respiratory rate will start to increase. Again, that's because of the increased effort and that paradoxical breathing. So you notice here that the respiratory rate has actually climbed to 60. The rest of the vitals remain stable, and so you may not notice much change in the stats, heart rate, or even the end-tidal in early or partial airway obstruction or partial laryngospasm. And then in this third clip, you'll actually see this is what will happen if laryngospasm is not identified and aborted. And so you'll notice in the video clip, the first thing that starts to happen is that the heart rate is still high, and then the end-tidal will drop off as the patient becomes apneic, and then you'll notice a decline in O2 saturation. And then the last vital sign to be affected is the heart rate as the patient starts to brady down related to the hypoxia. So just to reiterate, in complete versus incomplete laryngospasm. In incomplete, you'll have stridor, but the vitals will be maintained, and you'll still see some chest rising, again, that paradoxical breathing in many cases. Once laryngospasm becomes complete, you will no longer see any chest movement, the pulse ox will start dropping, and then the end-tidal will start to drop as well, and the patient will actually become apneic. The last thing, again, will be bradycardia.